India is seeing a rise in COVID-19 cases amidst the detection of two new subvariants, NB.1.8.1 and LF.7, which are currently under observation by global health authorities. The total number of active cases in India is now 1,010. Fresh cases are surfacing in Noida, Arunachal Pradesh, Lucknow, Karnataka and Thane. Delhi government is on alert amidst the rising COVID cases in the city. Chief Minister Rekha Gupta will review the preparations at LNJP Hospital today. Earlier on Tuesday, the Chief Minister had a meeting with the officials of the health department at Raj Nivas along with the LG. Noida has reported 19 active COVID cases, including 11 women and 8 men. All patients are experiencing only mild symptoms like common cold and are currently in home isolation. The district health department is conducting contact tracing and reviewing travel histories as well. Meanwhile, Arunachal Pradesh has reported its first COVID cases. A 34-year-old pregnant woman who arrived in Itanagar from Bengaluru on the 13th of May tested positive via RT-PCR after earlier showing symptoms of mild cough and fever. Her 53-year-old mother also tested positive but remains asymptomatic. Thane in Maharashtra near Mumbai reported 12 new COVID positive cases, taking its active count to 72. 9 patients have been hospitalized and 46 are under home quarantine. 10 patients who completed their home quarantine protocols have recovered. 2 individuals working at Banaras Hindu University's laboratory have tested positive for COVID-19. The 2 had recently traveled to other states, suggesting the possibility of infection during their journeys. Lucknow reported its first COVID case linked to the JN.1 subvariant. UP logged 10 new cases in the past 24 hours, taking the state's total active tally to 30. Karnataka reported 36 new infections on Tuesday, raising the state's active cases to 100. The daily positivity rate stands at 9.44%. Doctors and health workers have been instructed to wear masks. Kerala remains the worst affected with over 500 active cases and 3 deaths reported in the current wave. Health Minister Veena George stated that although the severity is generally low, individuals with comorbidities may face complications. The state government has mandated COVID-19 testing across all districts and is closely monitoring the situation. Meanwhile, a 40-year-old UP man with no known comorbidities died of COVID at Chandigarh's Sector 32 hospital. We have Dr. Sanjay Rai, Professor Community Medicine at AIIMS, now joining us on the broadcast. We also have Dr. Dhruva Chaudhary, HOD, Pulmonary and Critical Care Medicine, PGIMS, Rohtak, and Nodal Officer for COVID, Haryana, joining us. Thank you, both of you gentlemen, for taking time out to be with us. I'm going to begin by asking Dr. Sanjay Rai a very simple, straightforward question. We're discussing positivity rates, we're discussing active cases. This is a very bad kind of a deja vu that we're having, isn't it, Doctor?
I don't think it's a very bad thing. See, the rising number of cases is not a matter of concern.
Okay.
Currently, for this type of virus, SARS coronavirus is a respiratory virus. It is spread through many droplets. This type of fluctuation will happen even after 20 years, 30 years also. So, total number of cases is definitely not for our concern. Our concern is for increasing number of hospitalization, increasing number of deaths, your increasing number of severity.
Okay, Dr. Dhruva Chaudhary.
That should be any speculation should be based on the current evidence we have. In the last 5 years, this is not a new virus. We have generated a lot of evidence against this virus, against COVID-19 disease. And based on these evidences, we can say the current circulating variant JN1, JN.1 and their lineage are very mild, not very severe, not causing any severe problem, not
Okay.
causing any increased number of deaths. So
Okay.
monitoring is okay, but there is no need to be panic. Yeah.
Okay, Dr. Dhruva Chaudhary, would you agree with that? Something like this is going to keep happening, for the next 20, 30 years, and there is no cause for alarm despite the fact that we have more than 1,000 active cases.
Good afternoon to all of you. I do agree with what Dr. Sanjay Rai has said. You see, COVID has become endemic. In between, we had not been testing as much as probably has been there. And suddenly there has been a spurt in cases. Same thing I did talk to my colleagues in Singapore also, where you are seeing a number of rise which is there. And these things are, in our language, we call it as an endemicity. And these small increase will keep on happening. What Dr. Rai said is very important. We need to look at it. A, what is there any increased hospitalization? And B, is there an increased hospitalization in intensive care unit? If you ask me, we are seeing practically these all are influenza-like illnesses. And we saw a huge spurt in influenza this winter. And we had a high mortality which was there. Some amount of challenges are going to be there in persons who are immunocompromised. And similarly, the patients in pregnant females where we need to be a little concerned. But I think we need to understand that panic button must not be there. We need to be careful about it, keep observing, watch, and then over a period of time, see whether hospitalization rate is going or not. Secondly, this variant is having something interesting features like diarrhea is not uncommon, which we are seeing, which has been reported. Similarly, we are seeing a high-grade fever and some amount of a cough, which is coming up to them. Therefore, any person who comes to us with an acute influenza-like syndrome or person having diarrhea with the cough or breathlessness, then they need to be evaluated for COVID as well as for other respiratory viruses. We are seeing RSV. We are also seeing along with it, we saw eco and adenoviruses, and we saw right up to the end of March and beginning of April influenza. Therefore, when we are looking at it, let's not create a panic. Yes, there is a rise in cases, A. Even we are calling it not even we are talking of concern. What we are seeing is it is for the monitoring purposes we are seeing it. So testing needs to be spelled up primarily for the patients who are acutely sick or those hospitalized, not otherwise. Otherwise, we will unnecessarily create a panic and put a panic button, then that will not be good for anybody.
Okay, fair enough. Absolutely no need to panic. That's the message is very clear. Dr. Sanjay Rai, at this stage, what would be your advice to the public? Is it better that people with comorbidities at least restrict their travel, because we're seeing the fact that so far the rise in cases have been contributed greatly because there is no blockage on travel. People are traveling freely, which means that they will be able to spread this virus. So talk to us in terms of alertness from the public and authorities' perspective is concerned. What do you think are the best ways to go forward?
See, any speculations or suggestions should be based on the evidence we gathered in the last 5 years, right? It's very difficult to stop the propagation of this type of virus in the community, irrespective of any measure, either lockdown or wearing masks, etc. Very difficult to stop. If you recall, initially, when we implemented lockdown in March 2020, India that time reported only 5 to 6 cases per day. And even after lockdown, we reached to 1 lakh cases per day in September 2020. And then there was a gradual decline. Everything was open, no lockdown, nothing, no mask. And then there was a gradual decline, and we reached to 10,000 cases per day in February 2021. So if there is a immunity gap, this will propagate. If there is no immunity gap, this will not propagate. To the best of my understanding, India had severe devastating second wave, and then in January 2022, Omicron wave. And that is providing immunity to the entire population. Apart from the vaccination, we have very good vaccination coverage. So seeing all these, natural infection is long lasting, providing immunity long lasting, right? So there is no need to be panic first. They may take some precaution. But see, COVID, number of cases will rise for a few months. This particular virus, first time reported if I recall correctly, August 2023. So almost even this Gen 1 is also more than 1 year old virus. So this is not going to create any, and it's a very unlikely. I mean, and definitely I can't say this would not create any problem, but it's very unlikely in science. Overall, it's a probability game. So it's very unlikely that it's going to create a very severe problem either in terms of hospitalization or in terms of deaths. The number of cases may rise. Today is 1,000. It may go up to 1 lakh, 2 lakh. It's hardly matter, right? So taking precaution, some COVID appropriate behavior, anybody can adopt, but that is not going to help in long term. Okay, thank you.
Thank you. Dr. Dhruva Chaudhary, so for now, it's only about monitoring. It's not even about taking preventive action at this stage, isn't it?
You see, it's a cultural issue. If you go to the Southeast Asia or you go to Japan, Asia Pacific, they all wear the mask whenever they are traveling up. It's a good practice point. Like we sit in our respiratory OPDs, and since COVID, we are wearing our mask regularly and daily. I think that is a practice which is a good practice point. We should do it if we are doing air travel, we are going to the railways. If we wear masks, I think that's better. One. Secondly, those who are having a respiratory complaints or sick, they should avoid travel as far as possible. And that is not for the COVID, that is for the influenza and for all other respiratory viruses, even for the people who have got a tuberculosis. That's what we all recommend about it. So both things go hand in hand. But at the same time, it is also the time to relook at it, our preparations in terms of it, that we are reasonably confident that we will sail through it, that will not be too sick and illness, but there will be some number of patients who will be requiring ICU care, who will be requiring hospitalization. For that, we need to recheck our protocols. We need to recheck we need to reassess whether we have the things with us. That means what we simply call the hospital preparation. I think that is fundamental, which always must be done, and we need to keep on doing it up. That is all needed and required, nothing more, nothing less right now. And let's not create a panic, because this is not even what they're called. We are monitoring only. This is not even an interest or of a concern. Therefore, need to be careful. Same hype was raised when the Omicron had come up. Now, this is a variant of a Omicron, and let us accept it. It is a process of evolution, and this is bound to happen in all bacteria, all viruses. Even in the human being, we are seeing evolution. So I think it's a part of it. As Dr. Sanjay said, people have a robust immunity. The only group of people I am aware about, the people who had been landed up in a problem around 8 to 10.
Right.
All of us, some underlying immunity deficit who had it. But one word of caution here. Pregnant ladies, I would definitely like to be careful of, and they should try to wear the mask as far as possible. And if you don't have a work necessity, there is no need to go into crowded places.
Right.